You should have the relationship that you feel someone would take care of you in an appropriate way when something happens. And if you feel that's not the way, well, that's making things really difficult.
Fellow Homo sapiens! Now, in this week's Epilepsy Sparks Insights podcast, we have part 2 of 2 regarding epilepsy and sex with epileptologist Oliver Henning. Last week with Oliver, we spoke of sexual challenges commonly experienced by people with and without an epilepsy, but more frequently amongst people with. And this week, we shall go into more detail about what can be done to help improve the sex lives of people with an epilepsy, should they need that help.
My name is Oliver. Henning is the family name. I'm working as a neurologist and epileptologist in Norway in the National Epilepsy Center. I'm a neurologist. I'm also a psychiatrist from training. And now I'm working here at the Epilepsy Center. I've been working here for the last 20 years. And, specializing in epilepsy, EEG reading, doing some of VNS treatment, some rehab.
How do we help the many people who are finding their own sex lives challenging? Is there much that can be done?
I think the first thing is to start with is to talk about it.
Mm-hmm.
And there's kind of a call out to my colleagues, and I think try to open up for having this discussion with the patient. And I think it's more difficult for the patient to start the discussion than it's for the doctor, because we should be feeling safe with these conversations and opening up for, let's say, we know that people with epilepsy might also have these problems, and then we just see whether people respond or don't want to talk about it, and that's totally okay. So in any case, do not pressure anybody. That's of course. So I think talking about it and getting the feedback, what is the situation, what is the problem, has there been changes in medication, some medications which are more kind of inclined to have a negative impact, so there might be a change of medication which can be considered. There might also be checks on hormone levels, there might be like a normal check as a GP, there might be other issues which could influence. There might also be a referral to a sexual therapist, psychologist, which is important and to follow up on that. So there are some possibilities, but sometimes there's not one tablet to do it. And talking about tablet, of course, there might also be with erectile dysfunction. You could use medication like Viagra or something like that. Talk to a neurologist before. There might be a slight risk, increased seizure risk, but absolutely consider that and come in with it.
And I think it's important to note, isn't it, that although you said there might be increased seizure risk, say if you change the drug or decrease even the dosage, your potential for a seizure can be increased by the anxiety or depression and lack of sleep that you might experience because of your lack of or poor quality of sex life.
Of course, and I think this is always it's always like a picture with different angles, and you have to try to find what is best for you in the whole picture coming along. And yes, so I think consider it, but also we have to say, I think a lot of people are also anxious getting a seizure during sexual intercourse, and so or it might be triggered by sexual intercourse. That's a question and anxiety we meet, but let's say, everything can happen, but that's really unusual that kind of sexual intercourse would trigger a seizure. It might happen, but it's really really pretty rare. And I think when we talk about what can we do, I think there are also things we have to consider where we cannot give any clear, you should do it like this, but also be kind of a partner in a discussion how to talk to other people. Let's say you meet someone in a bar and you get interested in whatever. Should you talk to the person? Should you inform the person about your epilepsy? What might happen? How it might happen? Or should you just be quiet because the other person might react kind of rare and pull back? And I think there's, well, how to talk about it. That's also really a big issue. And I think, well, mostly patients over time have to learn to be the experts in communication about their disease or the epilepsy and everything that follows with it. And there, I think we doctors, also nurses, all healthcare professionals play an important role to support this development.
Yeah, I completely agree. I've met people who have been very nervous about telling a potential partner about their epilepsy, and I really understand why that was in that condition. Well, actually, for so many people,
Yeah.
and but we were also talking yesterday, weren't we, about how having educating yourself in your own epilepsy and your own disease and comorbidities can really give you more confidence about talking about the epilepsy and your whole life to a potential partner. And almost like, I think, well, this is the way I've gone about it. Maybe I'm strange, but it's almost like a tick box. If they behave a certain way or react a certain way, then which is non-favorable, shall we say, then that's it. Bye. Okay, next.
Yes, of course. And I would say, well, yeah, you say when you're in a sexual encounter with someone, that's kind of you're pretty vulnerable in the situation emotionally and whatever. And I think, well, it should be in the situation when you have epilepsy in addition, so you're even more vulnerable. So I think you should feel safe with the person. And I think, well, when you talk about it, as you said, it's kind of you should have kind of the relationship that you feel someone would take care of you in an appropriate way when something happens. And if you feel that's not the way, well, that's making things really difficult.
And how would you say that somebody could become more confident or feel able enough to be able to bring their epilepsy up with a potential partner?
Oh, wow, that's a difficult that's a difficult question. But I think, well, in a way, it's a bit like training and trying. So I think there's no perfect way, and or not a perfect way who fits everybody. So I think you have to develop kind of your way, and this starts. Trying to find persons you're really confident with, where you feel you can. It doesn't have to be the partner, but someone you could talk to, like a very good friend. You said, well, I've got this problem. How do you think I could do it? And maybe do a bit of a role play.
Yeah.
Let's say, well, it thinks I meet you in a bar, and how would I start, and how could be kind of an opening in telling the person about the epilepsy, and also telling about the seizures or whatever happens, and how they should react to. And I think when you do a role play, you have someone you can do that with, you can also get some feedback. Well, how did you came over? And this was really awkward. Don't do that, and try it in a different way.
Yeah, mate, that ain't gonna work. Yeah.
Yes, and then just like then try and see how things work.
What would you say to clinicians who are nervous about bringing this up with their patients?
Well, to clinicians, I would say there's not very much you can do wrong, and if you open up to talk about it. I think you have to admit for yourself and also for the patients that you don't have like a perfect tablet to fix it. And I think this is, as we're talking about, there are different factors and causes which could play in. And I think if you say, okay, well, there are some things I can do about medication, considering that. Try to find out, is there some kind of sexual therapeutic option? Is there there's sexual therapists, psychologists, whatever. Usually you can find them on the internet or website or whatever. So you have a bit like something you can offer to the patient. And I think then it's start talking about and giving it a talk and see what kind of problems come up. Some might be easy to address, and some might be difficult to solve. And some situations people say, well, I would like to have sex, but it's very difficult to find a partner, and that's not a prescription thing we can change. But at least it's a factor which is important for people, and sometimes it's okay to talk about it, even if we can't offer a solution.
And I think that can really help people just to know that it doesn't make them strange or weird or attention seeking or whatever, just because they have an issue with their sex lives or the other relationships, or both, because they're so interlinked. It doesn't make you strange.
No, absolutely not. And I think, well, we've been talking about yesterday also. Well, this is, I think it's often still it's the elephant in the room. So it's difficult to talk about it. And on the other hand, when you open, well, I think it's the same in Britain as in Norway, when it just opens these tabloids and you have this TV series where people are meeting naked
Yeah.
so sometimes you get the feeling, well, sex is everywhere and I'm the only one who is kind of weird. I think that's a really wrong impression. I think a lot of people, and when we look at data, as I said, even in general populations, there are ratings up to 50% of people reporting, let's say, sexual problems to some kind of degree. So I think that's pretty usual. And well, talking about it, and I think an issue is also what kind of experiences do you have and what kind of problems do you see?
Should we say that, as well as, well, I often encourage people to make a list of things to bring up with their clinician prior to an appointment, because we'll often forget about what we're going to bring up. If it's relevant and you need help with it, I would put sex life on that list as well.
Yes, absolutely. And I think this is, as you also mentioned, this is about quality of life and your life. And well, that's the main goal to achieve like the best quality of life. And I think, yes, put it on your list. And I know at some places there is this kind of prefabricated lists where you can kind of tick off and see, well, these are problems which could be related. And I think there should be also included, yes, sexual problems, sex life, depression, anxiety, and all this kind of stuff.
Gosh, we could go on forever, couldn't we? And not in a pervy way, just in a sort of biological, social, neurophysiological, so many, it's so related. If people want to get hold of you, Oliver, or just check out more about your work and your papers, what should they do?
They're free to contact me by email.
Cool. I'll put the link on the website.
Perfect. That's great. And yeah, well, take contact and I'll try to give some feedback. I'm not a sexual therapist, so I'm not the kind of a specialist within sexuality, but within epilepsy, and well, some issues we can contribute to.
Thanks again so much to Oliver for being that cool epileptologist, encouraging healthy sex lives amongst people with epilepsy, and indeed also encouraging other clinicians to cover the topic with their patients.